Hi, my name is Caara Lovick, and I am one of the co founders of Property Solutions Co op. And it used to be Miami Cleaning Co op, but then it evolved to Property Solutions Co op. Unfortunately, I am going to have to retire this project. It makes me very sad. I've been at it for about 2 years. And before that, now for the last 6 years, I've been advocating for worker owned cooperatives in the area of Miami Dade. And I've been in leadership programs like the New Leaders Council. That became Miami's Next Leaders. I also joined Catalyst Cooperative Program, and I did everything I could to encourage our community to try and help our cooperative sector grow. I had one project called Areify, which was a marketing channel that I wanted to set up here in town. I made it very easy for our progressive community to get involved with that. That did not end up happening. And then I had put together Property Solutions as a way to have our progressive community come together and support this project. And I was not able to get them to do that either, even though I was in programs and in organizations that said that they were willing to support this. And I made it very easy. I had put the partnerships together with incredible tech companies, with everything. Did the branding. Everything was ready to go. What we needed was some leads. We just needed 10 clients to get everything going. And not a single lead from our progressive community, not a single one. And I've been out here for about 6 years trying to advocate for these kinds of things. Now, what I think is happening is that our progressive community is, number one, not educated on the impacts of income inequality in terms of social and health outcomes. And I don't think that they are really prioritizing this the way that they should be. Now, if you're a progressive leader, if you are in a progressive organization in Miami, please, if you don't know about the impacts that income inequality has on social and health outcomes for our community, please check out the work of Richard Wilkinson and Kate Pickett. They are epidemiologists from the UK. These are health experts that study large populations. They put out 2 books, The Spirit Level and The Inner Level, How More Equal Societies Reduce Stress, Restore Sanity, and Improve Everyone's Well-Being. What they found was that income inequality produces poor social and health outcomes for developed countries and their communities. We're talking life expectancy, math and literacy rates, infant mortality, homicide rates, imprisonment rates, teenage pregnancy, trust levels, obesity, mental illness, including drug and alcohol addiction, and social mobility. That meant that the more income inequality that a community experienced, the worse off that they were going to do on these measures. Now, the reason why we think, right, anthropologists have told us, well, more than 90% of the time that we have been a species evolving, we have been evolving in a very different social environment than the one that we're in today. It's called the hunter-gatherer societies, right? And we were evolving physiologically, psychologically, emotionally in a very different social environment than the one that we are in today. In that social environment, there was meat sharing. So if you had a mouth, you were going to get fed. We had situational leadership. There wasn't just one person leading all the time. We were figuring out who was going to lead based on what needed to happen. And also we had counter dominance responses. That meant that there was never going to be someone sitting on top of a pile of blackberries while other people had no blackberries or very little at all. These things just didn't happen. And so now when we are faced with large inequality, we are having a lot of problems adapting because it's essentially very offensive to who we are as a species. And it is really causing a lot of problems. There is a research that was done by Dr. David Erdal regarding 3 northern towns in Italy. And he found that the more cooperatives that a town had, the better off that they did on pretty much like all these measures. So what that was really indicating was that even if we have just a little cooperative sector, we can improve the well-being of everyone. These benefits aren't just affecting the worker inside of these co-ops, but they are extending out into the community. It is very powerful. And it's very important that as a progressive community, we understand the science behind keeping our community healthy and happy. Because for the last 2 decades, suicide rates have been on the rise. And I talk to my friends in the mental health fields, and they say, we don't have enough resources to handle all of this. Okay. And this is pretty much a health crisis, what we're seeing. And if we don't understand the causes of this health crisis that we're really seeing, then we're going to have a problem solving it. So if you are a progressive leader, please understand what you need to know to ensure that you're strategizing correctly, because right now we're not. Because if we did, then this would be priority. We would be prioritizing the success of cooperatives. Programs to educate is not enough. We need to scale, and we need to scale quickly because this problem is really, really bad. Now, with that said, I'd be happy to put presentations together. I'd be happy to educate in any way I can. I've already done it for other leadership organizations in town, and that's a start. We need to begin with education. And if any organizations, any individual would like to learn more, please reach out to me. Again, I'm going to have to retire this project because of this. We are underdeveloped. As a progressive community, we're not educated on the problem. We don't have the buy-in. We don't have the kind of unity required to mobilize these solutions at the current moment. It's too bad, because this particular project would have made people a good living. And even if they didn't have any prior education. And it really breaks my heart because we're failing our community. That's what's happening. We're failing our community because we are not educated and we are not working together to mobilize certain solutions. And that's, unfortunately the truth of it. Now, there is some good news. I will be working with Indigenous communities to set up cooperatives for them, because they seem to understand just fine what I'm saying. In fact, they have things that they like to teach me about this problem, energetic and spiritual aspects of the problem. But they totally understand it. It is very in line with their values, worker-owned cooperatives. So, and I had been volunteering for them for a while, Amazonian and High Andean healers. And so we decided that it was time that we work together a little bit more seriously. And so I am dedicating my time to them and their projects. But, you don't have to be a wisdom keeper of the Andes to understand what I'm saying. Just look at the science. Just look at the science. It should not be this hard to mobilize these solutions. And we need to get there. So it is, I'm sad for our community. If you are a community member, hold your progressive leaders and organizations accountable. Ask them what they're doing to ensure that cooperatives are succeeding here in our local community. If they say, well, we have a program to educate people on how to put these together, say that's not enough. What are you doing to ensure that they succeed? What are you doing? What are you planning to do to mobilize these solutions? Are you willing to commit to an email blast? Are you willing to commit to, orientation events to ensure that your entire organization understands the importance of income inequality and the health implications that it has on our community? Really, just keep them accountable, because that is what it's going to take. And if you are a progressive leader, please educate yourself, because our community depends on you to understand the basics on how to keep healthy communities. Okay, how to help our community in real ways that isn't always depending on government intervention. Many of our progressive community members put all their eggs in that basket of pushing political candidates. It's very, very important. But it doesn't really matter if your voters are struggling with mental illness. Okay, it it, it it doesn't help when that environment that they're in is causing them to lose trust just naturally because their health is deteriorating. Come on, let's be smart about this. Let's have a long-term plan, and let's have some short-term plans, but we have to do both at the same time. They have to run parallel. Otherwise, we're going to have more problems than we have today, because we're going to continue to have a lot of problems in the future. So with that said, I will be around. Contact me at will. I will be focusing on this project for the indigenous community in the high Andes, the Kiro, and also the Amazonians, the Amazonian healers there. And again, not enough healers in the Amazon, not enough healers in the high Andes, not enough mental health experts, believe it or not, to help with this big problem. We need to start to change the way things are here and really go after the problem, because we are facing a health crisis right now. So please, reach out. If there's anything I could do, let me know. But I believe in you, progressive community. I really do. I want to chalk it up to lack of education. But again, you don't have to be a wisdom keeper to know what I'm saying. All you have to do is look at the science. That's all I'm asking you to do. Please look at it, and let's start to really make an impact for our community members. Thank you so much. I hope you have a great day.